Good afternoon, everyone, and welcome to the SERO SNAP-Ed Best Practices webinar. Today we'll be talking about measuring and sensating PSEs, and we have 3 great presentations lined up today, along with we'll see if Brittany has any words at the end to provide any closing remarks. Just so you know a little bit about us, I'm Amy DeLucio, the Director at the Center for Wellness and Nutrition. We are a program of the Public Health Institute, and we do host these webinars in conjunction with the Southeast Regional Office of SNS, and that slide just shows a little bit about what we do. I want to go ahead and take a quick look at our agenda overall. So we have 3 great presentations lined up for you all today. We have Ann Lee, Jason Forney, and Carrie Vosold from Michigan Fitness Foundation, and they'll be focusing specifically on implementing, measuring, and sustaining PSE. Our second presentation will be covered by Gil Woodward-Lopez from the Nutrition Policy Institute and Lauren Whetstone from the California Department of Public Health. They'll be discussing an integrated approach to evaluation of PSE-focused interventions. Lastly, we have Carrie Draper and Dr. Nicholas Younginger from the University of South Carolina covering the sustainability of PSE strategies. We'll then move into a quick Q&A and any remarks from SERO before we adjourn the meeting. Please note that all attendees, aside from our presenters, have been muted upon entering the webinar. If you have any questions throughout the presentation, please use the chat box feature and we'll be sure to review and discuss anything that comes up at the end. Reminder about housekeeping and using the Q&A box to send questions to a host and presenter. We will review those and go over them at the end. So I will provide you a brief background on our speakers from Michigan Fitness Foundation before we turn the mic over to them. Carrie Vosold is an evaluation specialist at the Michigan Fitness Foundation. She has a doctoral degree in kinesiology from Michigan State University. Carrie's areas of interest in evaluation include individual behavior change and PSE supports for physical activity, data aggregation, secondary data set analysis, and data visualization. Ann Lee is a project manager at the Michigan Fitness Foundation and supports its implementation of locally relevant supplemental nutrition assistance program education across the state. She oversees a portfolio of subrecipient grants and subcontracts, as well as manages support projects that help inform MFF's statewide SNAP-Ed strategy. Ms. Lee holds a Bachelor's of Business Administration from the University of Michigan, Ann Arbor, and has an extensive experience working with national and international nonprofit organizations, managing community-based development projects focused on health equity and reducing health disparities. Jason Forney is an evaluation specialist at the Michigan Fitness Foundation. He has a master's degree in doctoral training in ecological community psychology from Michigan State University. Mr. Forney has extensive expertise in evaluation, statistics, qualitative methods, and analysis, and theories of systems change. With 13 years of evaluation experience, he's had led numerous evaluations of coalitions and collaborations in public health settings. So without further ado, we will turn it over to the Michigan Fitness Foundation team to share their work on PSEs with you. MFF, go ahead.
Thank you for that kind introduction. This is Carrie Vosold, and today we're going to be sharing a little bit about the Michigan Foundation work in PSE, looking at implementing, measuring, and sustaining throughout our presentation. Before we dive into PSE, I just want to give a brief overview of SNAP-Ed at the Michigan Fitness Foundation. Our state SNAP agency is the Michigan Department of Health and Human Services, and MFF is one of 2 implementing agencies alongside Michigan State University Extension. We work with 50-plus community organizations each year around the state to implement programming, and approximately 30 to 35 of these organizations receive funding through a competitive subrecipient grant process via an RFP. For clarification, today throughout our presentation, we're going to be discussing information relevant to these subrecipient organizations specifically, and we'll use terms like partners or grantees in addition to subrecipient, but just so we're all on the same page that we're still talking about those organizations. With this subrecipient grant process, we have locally relevant programming happening as these community organizations have proposed what they'll be doing based on their specific communities. So for PSE, we end up with a variety of strategies and assessments, which can add some complexity to the implementation, measurement, and sustainability. And now I'm going to turn it over to Ann Lee to talk a little bit more about the implementation part.
Thanks, Carrie. So as NetBed has evolved over the years and PSE change has gotten increasingly important, we have found that our partner organizations or our grantees have varying levels of proficiency with implementing PSE change. In particular, identifying potential opportunities for PSE change in the community, knowing where to focus their efforts, and how to initiate PSE change work have been challenging. So MFF has tried to be really intentional about increasing our support to grantees about integrating PSE change strategies into their program. And one of the ways that we have done this is through a project that we began last year, which we call the Community PSE Exploration Initiative. And this initiative was offered to a cohort of our SNAP-Ed grantees as an opportunity to spend some focused time learning about the PSE change landscape in their communities and to really build their capacity to identify areas for relevant community responsive PSE change. So therefore, increasing the likelihood that their efforts would be more effective and sustainable. So in addition to looking at things such as community assets and barriers to healthy eating and active living and understanding root causes, we put a strong emphasis on meeting with community members and stakeholder groups to really understand what their interests and priorities for PSE change work were. And one point I do want to clarify is that the purpose of the project wasn't to implement any PSE change strategy at that moment. It really was focused on building organizational capacity to define where future community change was possible. In all, there were 33 MFF SNAP-Ed funded organizations, and these 33 organizations represented 35 SNAP-Ed programs across the state. And so in the end, a total of 63 communities were explored across the state of Michigan. However, with our partners' increased skill and ability to identify areas for PSE change, we anticipate that they will continue to expand upon their work into their other program sites, which are represented on the map here. So we can really see the potential impact and reach of this project. So to give you an idea of the PSE exploration process, the majority of the project was focused on the community exploration piece. And again, this was SNAP-Ed partners spending dedicated time out in the community, going out and talking to people, exploring what has or has not been done in PSE and why, and identifying potential PSE strategies in their program that their program could undertake in the future. That's really based on a solid understanding of the needs of the community. After the exploration period, partners then took that data and information that they gathered and put it in a community snapshot report. And that snapshot, in essence, was a summary narrative of their findings from the exploration process. And then lastly, partners synthesized the information from their exploration, pinpointed potential focus areas for PSE change efforts, and then developed an action plan to operationalize moving their SNAP-Ed program toward more informed and relevant community change work. And throughout the project, MFF, project staff, project managers provided ongoing technical assistance to the partners, such as developing tools to help guide the organizations through the exploration process. We held bi-monthly peer learning calls so that the partners could share experiences or tips with one another, expand their network of support, and to learn more about specific topics that were coming up during their projects. And for example, the topic of community engagement and strategies to outreach to community members was one of our more popular topics. So currently, we are in the process of wrapping up the PSE exploration project this month. However, we do have some initial results from the project on on how the project has been going, and if our overall goal of building capacity for PSE change work was achieved. And I'm going to actually turn it over to my colleague Jason to talk more about those findings.
All right, thank you, Ann. Sorry about that. Okay, so as part of our evaluation of the PSE Community Exploration Initiative, we conducted surveys with participants in December and January. 29 of 33 SNAP-Ed partner organizations submitted a survey for an overall 88% response rate. The majority of our surveys were submitted by PSE leads. On this next slide, you can see as part of this initiative, organizations collected community data from both SNAP-eligible community members and organizations. In total, partners reached 8,293 SNAP-eligible community members and about 793 organizations. Data collection methods were similar for both of these groups. So community conversations or group conversations were the most common method of collecting data that our partners employed, followed by interviews with individuals. Some did surveys, and then about a quarter used other methods such as walking audits, observations, and use of secondary data. In the survey, we asked participants, how confident do you feel in your organization's ability to do PSE work both before the PSE initiative and currently? 23% said they were very or extremely confident in their organization's ability to do PSE before participating in the initiatives. 69% said that they currently felt very or extremely confident in their organization's ability to do PSE work. So these results suggest that that our partners are generally feeling more comfortable in doing their PSE work, and it seems, and this initiative has played some role in that. Now, as a result of this work, over half of our partner organizations said that they had identified new PSE opportunities for their SNAP-Ed work as a result of this initiative. About 19% said that not quite yet, they're still working on it, and 27% were unsure. And I stuck a few quotes up on the screen. So one quote is, "We have identified new systems in our community that affect nutrition and physical activity. We could work on a transportation policy, affordable housing policies, and safety in neighborhoods. We likely will continue our PSE work around K through 12 education." And another quote, "We found there is a lot of excitement about systems changes in both communities. School gardens, gathering spaces for activities, and desire to change pantry and school cafeteria resources all came up as possibilities that can inform our future work." Now, I'm going to talk a little bit about our larger evaluation of our partners' PSE work. So data from this evaluation feeds into our annual FNS reporting. currently, we collect data using two methods. We use a web-based portal to collect ST8, to collect ST7 and ST8, and we use an Excel PSE reporting worksheet to collect ST5, MT5, MT6, ST6, LT5, and LT6. In the next fiscal year, these indicators will also be collected in the web-based portal, as we're currently building that out. For the web-based portal, when a partner logs in, they see a dashboard similar to what you see here on the slide. They see their agency's information on the left and a list of their programs on the right. As you see on the top of the screen, partners can click on the tabs to update their program information and program locations. This information populates the map on the front end of the database, and this map is accessible to the public and provides a visual representation of where SNAP at direct education and PSE programming is happening across our state. They also report on ST7 partnerships and ST8 multi-sector partnerships by clicking on the last tab, Partnerships and Coalitions. So here is a screenshot of the from the portal for ST7 partnerships. So here you can see that partners will enter the name of the partnership, a description and purpose of the partnership, the geographic level, which is a drop-down menu, including local, regional, tribal, and statewide, depth of relationship, and those include network, cooperation, coalition, collaboration, and coordination. Also, we ask our partners to describe any lessons learned from the partnership and any accomplishments or progress. And our partners enter ST8 multi-sector partnerships in very much the same way. So I'll move forward in the interest of time. So as I said earlier, ST5, MT5, MT6, ST6, LT5, and LT6 are reported using an Excel workbook. And this is a screenshot from the first section of the workbook that we pre-populate with the locations the partners entered in the update portal. Partners then report on the relevant indicators for each of the sites that they have been working at. So if you keep scrolling right in the workbook, you would see columns and empty cells for the user to enter data for the relevant indicators. Instead of doing that, I'm just going to review the data elements that we gather for each pre-populated site. So for ST5, we ask for the assessment name, what was assessed, assessment completion date, key findings, including a score and narrative, assessment results. So did the assessment results suggest a need for change or readiness for change? For MT5 and MT6 adoption of nutrition and physical activity supports, we first ask the partner to describe their progress. And if they have made a change, then they go on to fill out the fields describing the assessment that drove the changes. Also, we ask for the number of environmental changes, systems changes, policy changes, and promotional changes. And for each of these areas, we ask our partners to provide a description of the changes and how they knew that the change occurred. And so partners usually, in this field, they'll usually indicate direct observation, photographic evidence, interviews, policy adoption, written process or practice, or repeated self-assessments. And finally, Reach is reported separately for MP5 and MP6. I'm going to move through in these last slides quickly in the interest of time. We also collect ST6 champions, and here's a list of some elements that we collect. And we also collect LT5 and LT6. And this includes implementation. So partners will indicate if they've done evidence-based education, marketing, parent community involvement, staff training on continuous program and policy implementation, and then effectiveness, the name of assessment tool used, the pre-assessment date, results, post-assessment date, post-assessment results, and do the pre and post-assessment results indicate need for improvement? So to ensure data quality, we conduct a number of trainings and technical assistance webinars with our partners. And so all data that comes in are reviewed by at least 2 individuals. And so, and that's usually a project manager and a member of the evaluation team. And so the project manager will ensure that the information is complete. They verify that what is submitted meets criteria for a given indicator. And the evaluation specialist will provide a second verification. And if consensus is not reached, a third reviewer is consulted. And there are many possibilities for analysis with this data. First, it's very flexible, so it's not, so our partners are doing a lot of different initiatives. And this method of collecting data isn't dependent on any strategy or assessment and supports locally relevant programming. It captures qualitative, narrative, and quantitative data, provides overall aggregates, and that allows us to stratify by assessment tool or setting strategy. And we also conduct a qualitative analysis, importing narrative data into in vivo and coding for themes. Okay, and now I'm going to turn it back over.
All right, this is Carrie again, and Ann and I will finish up talking about some of the methods we're working on for sustaining our PSE efforts. We recognize that PSE change is hard, and we don't have all the answers. However, we are participating in some of the national conversations around PSE and SNAP-Ed, and we're continuing to learn and adapt our programs around what's being discussed. Some of our future directions include all of our PSE being built into the portal. We're hoping to improve the user experience from our partners' perspective with the system, and we'll also have the ability to update information throughout the year, which we think will be really valuable. We're also exploring promising practices around assessing quality and effectiveness or impact of PSE change efforts. And we're spending time working on the data interpretation as far as how this can inform programming. We're focusing on how we and our partners communicate our SNAP-Ed stories. This can be with our partners communicating to us as far as their programming and PSE change that's happening, as well as to the general public and community members and to our stakeholders. Now I'm going to turn it back over to Ann.
So another way that we see ourselves moving towards more sustainable PSE change is really going back to what we started out the presentation with, and that is going back to that locally relevant, community-focused approach to SNAP-Ed. So by not only focusing on sustainability, but also on what PSE changes will be effective in meeting community needs and which are a good fit for the community, we see this as a way to endure and driving community change. The community PSE exploration, was a first step in providing our partners with the building blocks towards making meaningful, sustainable change. We continue to emphasize with our partners the principles of collaboration, community engagement, and equity and inclusion as key pillars to sustainable change. First, as we saw with when Jason presented on our evaluation of SP7 and SP8, we have put an increasing spotlight on collaboration. We know that community problems can be complex, and we can't tackle them in isolation. And so partnerships and collaborations with multiple diverse stakeholders and sectors is essential. Also, whenever we talk to our partners about future programming or strategy, the conversation always goes back to what are the community needs? And that's because understanding community needs, their priorities, and factors such as social determinants of health can really help organizations implementing SNAP-Ed on the ground pursue more effective PSE change strategies with more community buy-in. And then finally, we would be remiss to talk about sustainability without mentioning equity and inclusion. Sustainability or sustainable change is equitable and inclusive. So supporting our partners to lift up community voices and engage in more capacity building around these areas are a growing focus of our work. So with that, we have reached the end of our presentation, and we would be happy to address any questions towards the end of the session. So thank you. We appreciate your time and attention.
Thank you, Michigan Fitness Foundation, for sharing your comprehensive strategy to PSEs, and we will hold questions till the end. I know some were typed in, so we'll be sure to read those at the end of the all presentations. So we are going to move on to our second set of speakers from California. Our next presenters are Lauren Whetstone and Gil Woodward-Lopez. Lauren Whetstone is Chief of the Research Evaluation and Strategic Alignment Section in the Nutrition, Education, and Obesity Prevention Branch at the California Department of Public Health. She is leading efforts to evaluate healthy eating and active living policy systems and environmental change strategies implemented by local health departments as part of their SNAP-Ed grants. She is also an author and editor of the SNAP-Ed Evaluation Framework and serves on the Association of SNAP Nutrition Educator Administrators Evaluation Committee. Lauren has a PhD in Applied Cognitive Psychology from the Claremont Graduate University. She held a faculty position at East Carolina University in Greenville, North Carolina, with 18 years' experience evaluating community and clinic-based obesity and chronic disease prevention interventions in underserved rural communities. And our second speaker is Gil Woodward-Lopez, MPH-RD, Associate Director of Research at University of California Nutrition Policy Institute. The focus of her work is the evaluation of school and community programs to prevent childhood obesity. She has evaluated several multi-sector place-based obesity prevention initiatives and has led statewide and multi-state projects to evaluate school wellness policy implementation and school nutrition legislation. She recently served on the IOM Committee on Physical Activity and Physical Education in the School Environment and the President's Council on Fitness, Sports, and Nutrition Science Board. She currently directs work under a subcontract with the California Department of Health to evaluate their CalFresh Healthy Living program. Thank you both for joining us, and we will turn it over to Lauren at this time to begin the presentation. Lauren?
Yes, thank you. Good afternoon or good morning to those of us on the West Coast still. And thanks everybody, Amy and PHI, for the opportunity to share our experience implementing and evaluating SNAP-Ed in California. So like Michigan Fitness Foundation did, I'm just going to start with a little bit of background. In California, SNAP-Ed is known as CalFresh Healthy Living. And it is one of 4 CalFresh programs that include CalFresh Food, so that's the food benefit program, employment and training, and disaster response. For CalFresh Healthy Living, which is SNAP-Ed in California, the state agency is the California Department of Social Services, who funds 4 state implementing agencies, and you can see those here. That's the California Department of Public Health, the CalFresh Healthy Living at the University of California, Catholic Charities of California, and the California Department of Aging. These state implementing agencies, in turn, fund local agencies to implement the CalFresh Healthy Living program. So today, Gail and I are going to focus on the work of the California Department of Public Health, and we fund 61 local health departments in California. So that's the work that we fund through CDPH. We're going to concentrate our talk today on our evaluation approach and present some data to show some of our evaluation successes. So I'm going to start just a little bit by telling you that in California, we are in FFY 2020 in the first year of a 3-year SNAP-Ed plan. In this plan, counties in California prepare an integrated work plan that includes the collective work of local implementing agencies. So just to give you an example, if a local health department is SNAP-Ed funded, and a local Catholic charity agency, and a local area office on aging, for example, if those are all SNAP-Ed funded through their state implementing agency in a county, they prepare a work plan, an integrated work plan for that county that includes the work of all 3 of those agencies. In FFY 2020, for our 3-year plan, we developed an integrated work plan blueprint that is used by all implementing agencies. And in this blueprint, we specify specific PSE strategies and settings for CalFresh Healthy Living work in California. So California local health departments, who are the people that we fund, select from a menu of 9 PSE strategies, and I'm going to show those to you in just a second, in a limited number of settings. In defining these strategies and settings, we did that using a set of criteria, and we used a process that involved internal and external stakeholders. So I'm just going to give you, I'm not going to list all of these, but for example, the criteria included things like the strategies were evidence-based, they were feasible, they maximize impact, they focused on our SNAP-Ed evaluation framework priority indicators, they work in a 3-year timeline, they're sort of timely and have momentum in the field. These were some of the criteria that we used in selecting these 9 PSE strategies and associated sub-strategies and the settings in which we work. So let me show you the strategies. These are the 9 PSE strategies. You can see there are 6 nutrition-related strategies, so things like nutrition standards, healthy default, access to healthy food, and 3 physical activity strategies, such as active transportation, access to physical activity opportunities, and daily quality physical activity. So these are the 9 PSE strategies that our agencies, from which our agencies select their work. And they do them in these particular settings. You'll see that the title of this slide says CDPH Settings. That's because we, for our specific local health departments, limit their work to the strategies in these particular settings. Some of the other implementing agencies in California work in other settings that are more appropriate, like Catholic Charities has other settings that they work in that are more appropriate to their work. But these are the settings in which our local health departments do their PSE work. Okay. Then I just have one more slide before I turn it over. Oh, the one thing I did want to say, sorry, I forgot. I wanted to let you know that the strategies that are implemented in these settings are integrated with cross-cutting activities across the whole IWB blueprint that include quality direct education, partnership and coalition work, and community engagement. So those three things, direct ed, partnership, coalition work, and community engagement, are considered cross-cutting activities that are work that's done with every one of those PSE strategies in every one of these settings. So the approach that I just described reflects a model that leads with PSE work. So we lead the work with PSE work that is integrated with direct education, indirect education, and includes, as I mentioned, partnership, coalition, and community engagement work. So with this new blueprint, we really had to assess our existing evaluation of activities, assess our approach, and we made some modifications to the way that we're doing evaluation for CDPH agencies in California. And we really see our evaluation sort of happening in three different categories. And I'm just going to give you an overview, and Gail's going to go into more detail about each of these. So the first group I'm going to call site-level programs, policies, and practices. And this is information that's entered by local agencies into the Program Evaluation and Reporting System, or PEARS. So many of you may have heard of PEARS or seen PEARS before, much like the system that Michigan just explained also, where information about direct ed activities, indirect activities, PSE work, partnership is all entered into this reporting system. This also includes, and Gail will go into more detail about this, site-level assessments that cover site-level policies and practices and PSE work that's done at the site level. So then we use outcome data to study the associations between specific outcomes and our interventions as they're captured in PEARS and through the site-level assessments. So some examples of outcome data that we might use include things like FitnessGram, which is done routinely in California with all 5th, 7th, and 9th graders, and the California Family Health Study, which is a study that is coordinated by the California Department of Social Services, our state agency, and it's a survey that collects 24-hour dietary recall and self-reported health behaviors from SNAP-eligible moms, children, and teens in 30 counties in California. So that's some of the examples of the kinds of outcome data that we have that we associate with the activity information that we get in the programs, policies, and practices arena. And then finally, we conduct 2 evaluation projects right now that we call self-contained, in that these are studies where we collect both the intervention or exposure and outcome data, and that's what we're calling our impact outcome evaluation and some strategy-specific evaluations that Gail will go into more detail. So I am going to turn it over to Gail now to give you, again, more details on these evaluation approaches, and then to share some of our results that we're excited to present and share with you.
I apologize. I think I jumped to the end of the presentation there accidentally. I'm just scrolling back up to where I'm going to start. Great. So our first PSE evaluation efforts focused on reporting of the PSE activities, changes made, and reach. This is particularly important in California because in California, each local health department chooses their own intervention locally. And although guidance is provided at the state level, it is not strictly prescribed. We did this for a couple of years with our own system, learned a lot about it, and then switched to the PEARS reporting system, which is an online national system based out of Kansas State University. We moved to this platform because it was more user-friendly and state-of-the-art and allowed us to a lot more flexibility in the way we handled the data. One of the most important things we did when we switched to this platform was have site-level reporting with permanent IDs for every site. And although this seems like a simple and obvious strategy, it was very important and allowed us to track sites over time, what changes were being made, how long they worked with the sites. We really got this like picture over a long time frame. It also, as Lauren had alluded to, allowed us to determine population exposure. So we were able to, by having detailed information at each site, we're able to relate what happened at that site to people who patronize that site, such as students at schools or shoppers at stores. This really allowed for maximum flexibility in analysis and reported, and really made us able to use this important program information to examine outcomes and impacts of SNAP-Ed in California. This is just an example of how we've used some of the information, or how we presented some of the information. In terms of reach, we were able to look at how many people we reach, how many counties we reach, total number of sites reached in those 51 counties. This year is actually 2016. These numbers have all increased over time. And then we were able to look at how many sites per county and how many different settings to let us get a better understanding of the breadth of their work. And then looking more closely at reach, we were really able to easily describe reach in terms of both sites and settings, with the green bars here representing sites and the purple bars representing representing people reached. And as you can see, schools were by far, had the biggest reach, both in terms of sites and people. And although stores did not have a lot of sites, they did have the biggest reach, showing that each store has a much bigger reach than any of the other settings. And if you notice with early childhood, although there's quite a few sites, they were second in terms of number of sites. The reach per site is actually quite low, so it comes down lower in terms of the number of people reached, which again helped us understand better how we were reaching people in California. But of course, we don't just want to count people and find out how many people are reached, because in addition to reach, we really want to know what types of interventions they're doing and how potentially impactful those interventions are. So with looking at the data on the changes that they made from the PEARS PSE module, we were able to summarize what was being done in the different settings. And for example, in schools, we found that primarily in 2016, they were focusing on promotion, which isn't really a PSE, and gardens. And they had actually a relatively low number of different types of PSE changes per site, with only 55% doing more than one change. That was contrasted with the situation in early childhood education, where we had the most comprehensive combination of strategies, where they were doing almost 5 different PSE changes per site, with an 82% doing more than one change, suggesting that in ECE it was easier to work in a variety of areas within that and do a more comprehensive change in the setting. Stores also had a limited number of types of changes, and they focused primarily on marketing and promotion and less on availability and quality of what's being offered. Again, this allowed us to make recommendations on how to focus towards more comprehensive work in the schools and to move into more availability in the stores, for example. So with these PEARS PSE findings, we immediately set into how can we use this data most effectively. And as you've seen, we used it to describe reach and strength, but we also decided to quantify reach and strength, to get numbers for both of those figures. And I'll describe a little bit more how we use those numbers. And of course, as Michigan laid out, we used them to generate key indicators from the evaluation framework for reporting purposes. And also we use this data to look at surveillance over time in PSE environments in California. And perhaps the most exciting way we use it once we've quantified these numbers is to actually look at exposure to PSEs at the community and individual levels. And I'll show with you an example of how we've done this. Basically, if you look in the boxes off to the left here, we define exposure in 2 ways. One is whether or not there was any intervention at all, and then we actually give a score for the dose of that intervention, which is a function of reach and strength. And then we can relate those to outcome data. In this case, as Lauren mentioned, this would be in the school. So here we're looking at schools only, and looking at students that attend those schools. And we can relate it to available outcome data we have on intake of fruits and vegetables, for example. We also have sugar-sweetened beverages and the HEI index. And from the fitness gram, we can look at the relationship between the interventions and both BMI and VO2 max, which is a measure of cardiovascular fitness. And here are some of our preliminary results. Here you can see we looked at, this is simply looking at yes or no in the intervention. And if you look at the green bar would be no students attending schools with no exposure to CDPH SNAP-Ed, and those with any exposure to CDPH SNAP-Ed. And as we see here, there was a significantly greater intake of fruits and vegetables by about 1/4 cup. It moved from about 2.5 cups to over 2 3/4 cups a day of fruit and vegetable intake. And this was a significant difference, suggesting that SNAP-Ed is having an impact on this outcome. We also looked at our dose measure, which again is a numerical measure of reach times strength. And when we looked at this in relationship to our fitness gram outcome of VO2 max, you can see here, in this case, the statistical analysis is combining these 4 levels of dose to those that got no exposure at all. We can see that in those schools where they had a medium high or high level of SNAP-Ed physical activity intervention, they had significantly and substantively better VO2 max, so improved cardiovascular fitness, compared to those that got none, low, or medium low levels of dose or exposure. It's also interesting that that our combinations, it tells us a little bit about the combinations of strategies in each of those dose levels. And we find that the most effective interventions were those that were mostly PSE or mostly a combination of PSE and direct ed or indirect ed, really supporting our model that this combination of the 3 is likely to have the most powerful impact on outcomes of interest. As useful as PEARS is, we wanted to, after a few years' experience with using the PEARS and PSE specific data, we wanted to delve a little bit more deeply into what was happening at the site level. So we have just recently completed development of site-level assessment questionnaires, which we refer to as SLACs. These are site-level assessments of institutional practices and policies, and their purpose is there's multiple purposes. One, they can be used as a needs assessment and program planning. So now all of the local health departments administer these in the 4 settings for which we have developed them, and use them to plan their programs, identify strong and weak areas at each site. For us, what was really important is these were specifically designed to be useful for evaluation and monitoring. They are very comprehensive, so unlike PEARS, which looks at the changes that were made, these SLACs look at all of the possible environments at the school where you could be doing PSE or education. And therefore, we get information on changes over time by administering these each year. We can look at both the environments they are working on and the environments they aren't working on. And if they're not working on them, we can use those as control variables, and the ones they are working on, we can use as exposure variables. They're also much more detailed and more precise, so give us a more precise measure of strength and allow us to pick up on more subtle changes over time in these environments. And here's just an example of what that might look like, a change over time as picked up by the SLACs. And here you see this is an example of our early childhood education SLAC. You can see the 7 areas over which we ask questions, so very comprehensive, and there are several questions in each of these areas, and they are assigned points for each question. And then actually it is designed to automatically generate a score. So they get immediate results, and they get a score for each of these sub-areas, and they also get an overall score. This is fictional data because we have just started using the SLACs. In fact, we've just finished collecting data for our validation study. Here you can just see what it might look like, the change over time in these scores. And basically these scores are in percentages. That'd be percentage of total possible points in each of the areas and total points over time of the total overall score change over time. What's really nice about this is we can also use these numbers in a dose analysis similar to what I showed you how we used with the PEARS data. But of course, we don't just look at PEARS and SLAC data. We wanted to dig deeper into some specific evaluations. We also do what we call the self-contained evaluations. That's where we collect both the process evaluation or the exposure data and outcome data. And one of the main ways we've done this for many, many years, or CDPH has done this even before MPI got on board, was through what we call the impact outcome evaluation. And this used to be pre-post evaluation of direct ed because, of course, direct ed was the primary work of SNAP-Ed a while back. It was not setting specific, dealt with a variety of ages. The questionnaires tended to cover many nutrition and physical activity behaviors. Because of challenges in recruiting comparison sites, there was little comparison sites recruited, and therefore it was really difficult to attribute any change to the actual intervention. And sometimes we were repeatedly evaluating the same curricula when really once a curricula is found to be evidence-based, it's not necessary to continue to evaluate. So considering these limitations of that process, we redesigned the outcome evaluation, keeping the best parts and upgrading it to our new model. And most importantly, number one here is that we decided we didn't want to evaluate just direct ed. We wanted to evaluate the combination of interventions that we're encouraging local health departments to implement, and that would be the combination of PSE, direct ed, and indirect ed. In order to evaluate the whole package, we didn't want to administer a survey pre and post the curriculum. We wanted to do it at the beginning and ending of the school year. So that would capture the potential outcomes and impacts of this package of interventions. And then we also wanted to follow the same school for 3 years because we know that PSEs in particular may take longer to affect behavior than, for example, direct ed. We wanted to give a chance to really capture all the changes, all the outcomes that could be happening as a result of these PSE interventions. We also wanted to increase power, sensitivity, and focus. So we, as you saw earlier in the slide, schools are really the predominant site where the LHDs are working, or setting where the LHDs are working. So we decided to focus on schools where we could get a reasonable sample size, and we focused on 4th and 5th grade because most of them working at the elementary level, and there are no available valid instruments for grades lower than 5. And we also used a more sensitive, focused, and validated instrument, and all of our sampling was based on power calculations. I forgot to include one of the most important things on this slide was we now have an increased number of comparison sites that allow us to do impact evaluation and attribute any changes we see to the intervention. And what's really nice is that we're able to use the SLACs at all of these school sites, and that will allow us to control for baseline environments and practices that otherwise might confound our results and obscure the impact of the SNAP-Ed work at these sites. And finally, we also like to dig down and do specific evaluations of particularly innovative strategies that we're trying out. And the first one focused on a current legislative development in California, which was legislation for healthy default beverages in kids' meals, which legislates that the default beverages in restaurants for kids' meals has to be plain milk and or water. We wanted to use this as an opportunity to test a specific intervention model that seemed really promising, and that is to answer the question of, does local support of a statewide policy improve policy outcomes? And this was the perfect opportunity to do that, as this legislation passed just in January of this year. We were able to collect baseline data in December. because of the legislative component of this, we had a two-part evaluation strategy, which was to collect data both pre and post legislation, and then post legislation, but pre and post the local intervention with a comparison group. The impacts that we looked at were changes in what was listed on the menu board, changes in how beverages were offered during ordering, and changes in customer purchases that we did through intercept interviews with customers. This study is in progress. Here's just a little teaser of some preliminary evaluation results. And here you can see that we did see positive changes before and after the legislation, with an significant increase in water being offered, no change in unflavored milk, a decrease in juice, decrease in sugar-sweetened beverages, decreased in flavored milk, and decreased in just drink not specified on the menu boards. So these are promising initial results and are very much explained by the landscape in California, in that prior to the legislation, many of the restaurants in our study had voluntary standards to offer water, unflavored milk, and juice. And as you can see, one of the primary impacts of the legislation was to decrease the juice, since that was no longer allowed. And so in summary, we use a variety of methods to evaluate SNAP-Ed, otherwise known as CalFresh Healthy Living in California, but we don't really evaluate PSEs completely separately, but rather like to evaluate the whole package of interventions as defined in our intervention model. These separate evaluations are coordinated pieces of an overall evaluation strategy that answers the three fundamental questions. To answer what are we doing and how well we're doing it, we primarily use PEARS and SLACs to look at reach, strength, and dose, and then to determine if our efforts are really making a difference, we compare PEARS and SLAC data to secondary outcome data. We do impact outcome evaluation and strategy-specific evaluation. And finally, we use all of this information as a means to look at changes over time in SNAP-Ed efforts, institutional practices, and our outcomes of interest. Thank you.
Thank you, Lauren and Gil, for sharing your comprehensive model in California. We're going to now have our final guest speakers go from the University of South Carolina. And I will introduce the speakers. Carrie Draper is a Senior Research Associate with the University of South Carolina Arnold School of Public Health Department of Health Promotion, Education, and Behavior, and Principal Investigator of the SNAP-Ed Implementing Agency. She has been with the Arnold School for 9 years, conducting research and evaluation studies and leading projects to understand and address food insecurity and obesity, strengthening public nutrition assistance programs, and building community and organizational capacity to change policy, systems, and environments to make healthy eating and active living more accessible in communities. Her professional identity and educational background are rooted in social work and social justice. Dr. Nicholas Younginger is a co-investigator for University of South Carolina's SNAP-Ed program and research assistant professor in the Department of Health Promotion, Education, and Behavior and the Arnold School of Public Health. Nick received an associate's degree in culinary arts from Johnson & Wales University in Charleston, South Carolina. He received bachelor's and master's degree in cultural anthropology and a PhD in health promotion, education, and behavior from the University of South Carolina, and has worked with the SNAP-Ed program for approximately 5 years. Carrie and Nick will be talking about sustainability of PSE strategies, and we will turn it over to them now.
Okay, thank you so much for having us as a part of these presentations today. So Nick and I are going to be talking about a qualitative study that we did a couple of fiscal years ago around really trying to understand the sustainability of PSE strategies that were being implemented in partnership with the South Carolina SNAP-Ed program. So to give a little bit of context, considering, of course, that state SNAP-Ed programs look so different state to state, so I think it's always interesting to understand what structures for the program look like during these presentations. But we at the University of South Carolina are one of 4 SNAP-Ed implementing agencies in the state. So our state Department of Health and Environmental Control has been a SNAP-Ed implementing agency for many years here, as well as our one of our main land-grant institutions, Clemson Youth Learning Institute, and then also one of our regional food banks is also another implementing agency. And those three implementing agencies largely focus on delivering nutrition education to people across the lifespan in lots of different settings, as well as working on PSE strategies. And we at the University of South Carolina came online as an implementing agency towards the end of fiscal year 2015, really in an evaluation role. And so a lot of our initial work looked at the capacity that the implementing agencies and kind of thinking about the SNAP-Ed program as a whole in South Carolina, what the capacity and opportunities for building the capacity were to support sites and partners in PSE implementation in conjunction with doing direct education. And so certainly over time, our evaluation work has evolved and changed based on new questions and needs that we have. So you can see by the slide that a lot of our evaluation work at a state level nowadays directly aligns with the SNAP-Ed evaluation framework. We also have started doing some of our own PSE implementation projects out of the university here. But one of the things, after working with the implementing agencies for a couple of years on building and tracking the work they were doing around working with sites and partners and adopting PSE strategies, we really wanted to start then looking at, were those strategies then being sustained over time? And so that, just thinking about, we know that based on also the SNAP-Ed evaluation framework, that SNAP-Ed implementers are encouraged to be working with sites and partners on sustainability planning, really trying to understand, was that happening, were strategies being sustained, and then what was driving or what was lacking in the sustainability of the strategy. So I'm going to turn it over to Nick now to talk more about how we designed our study and what our analysis approach was.
Thank you, Carrie. So as Carrie just mentioned here, the object of this was to dig a bit deeper into what the context and quality of sustainability looked like across sites that had implemented PSE strategies in South Carolina. And so, oops, go back. Sorry about that. So we adapted a tool, the program sustainability assessment tool, to think about to get at that context. So that tool has 8 planning domains you can see on the left there. It is a quantitative tool that is built around each of these domains having some subcomponents, each of which you administer with a Likert type scale, and you wind up by putting the scores for each of those components across the domains. You end up with a sustainability score for a program. We like that overall approach. However, the tool is really focused on programs as a whole, whereas we're looking at specific PSE strategies in a given site. And so we felt that we needed to kind of adapt the tool a little bit and wanted to employ it qualitatively to get at some of that context around sustainability at a given site for a specific strategy. And so we added, and you can see on the right side here, 2 quote domains. One around the current involvement at the time of the interview of SNAP-Ed implementers at the site. So how involved is SNAP-Ed still, or have they, implemented a PSE and moved on? And then also the involvement or interest of SNAP-Ed participants in the strategy. So how much buy-in or interest was there for the target population of these strategies towards the implementation of them? Did they have a say? Did they have was there a need, or at least a proclaimed need, for implementing that strategy or not? And so we, in adapting this from a quantitative tool to a qualitative interview, I've just highlighted a couple of the domains so you can kind of see our process a little bit. And so on the left, of course, we have the domain from the tool, and then the tool's definition of that domain that we worked from. So for example, for environmental support here, we had having a supportive internal and external climate for your program was the definition by the sustaintool.org. And then a couple of the components, such as champions within the domain for environmental support are represented on the right in the qualitative interview questions. So, looking at level of support from within and outside of the site for a particular strategy. And so each of these questions needed to be tailored from the tool, but then also in the interview tailored to a specific strategy. So you can see the idea of a champion there represented. And with organizational capacity, same sort of process. You can see that, for example, in some of our probes and sub-questions, we ask about, for example, the vision. Was the vision of the PSE strategy communicated to external partners? That's a subcomponent that's quantitatively assessed in the tool, but we turned it into a qualitative interview question. So here's just an overview. So kind of some of the base questions, the main questions that we then had sub-questions we just saw for a couple of these and probes around each of these components. But I just wanted to show you what some of the main leading intro questions are for each of the domains around each of these. So all right, so we looked at all adopted PSE strategies from fiscal year 2017. And we conducted an interview 6 to 8 months post-adoption for a given strategy. We wound up with a final sample of 31 strategies at also 31 sites. The way we analyzed this was by first audio recording the interviews and having those transcribed verbatim and entered into in vivo for theming and analysis. And we started by using the 8 domains and looking at the interview transcripts to determine whether, just at the surface level, a given domain was present or absent, or as we call it, evidenced or not evidenced. We then did that across all of the transcripts, regardless of strategy. Then we went and looked at whether the strategy was sustained or not sustained at the time of the interview. So remember, this is 6 to 8 months post-adoption. So some were sustained and some were not. However, we also dug into those terms a lot. So rather than just having sustained and not sustained, we did immersion analysis on those strategies to, like I said, dig in more to provide more context around what sustainability actually looked like. So is it sustained? And if so, exactly how does that look? And Carrie's going to provide what those subcategories are in the context of our results in just a moment. And then we also dichotomized the categories of sustained and not sustained. And again, we'll demonstrate this with the results and how it looks with each site in just a moment. But we dichotomized the categories of sustained and not sustained, and then looked at whether we saw if there was any correlation with a given series of domains with whether the strategy was sustained or not sustained. So we can make comparisons between groups that sustained what domains were present versus the ones that were not sustained. Was there any kind of significant difference we saw there? And I'm using significant and correlation, not in statistics sense. I'm using that just in terms of more qualitative proportion and things like that. So Carrie's going to talk a bit about the results.
Thanks, Meg. So out of the 31 then sites that were interviewed, we found that 24 PSE strategies had been sustained, but to varying degrees. And then, of course, the other 7 had not been sustained at the time of the interview. And so as Nick was talking about, one of the ways that we looked at the data was kind of these, what we term storylines that surfaced. So commonalities that surfaced among different sites. And then we also dichotomized those based on ones that we as coders deem to then have high capacity for future sustainability. So those are the 2 categories that you see here of going strong and going with site investment, but that we deem to be unstable. And I'll talk more about what we meant by that in the blue. And then the 3 categories in the red, so going but lack site investment, going but with site planning to discontinue the strategy, and then ones that were not going, the strategy was not in effect at the time of the interview, we deem to have low capacity for future sustainability, because we certainly recognize that doing these interviews just 6 to 8 months post-adoption, that doesn't necessarily mean that those strategies are necessarily really going to be sustained for the long term. So trying to look at it more from, are the strategies, yes, in effect still today, just a half a year or a little bit more after the adoption, but also do we really think that those strategies are going to continue for the long term and kind of be institutionalized within these sites and settings. So just to give, one of the things that we did with the results in these storylines were to develop some case abstractions to illustrate and provide quotes from the key informants, and we're happy to provide our evaluation reports that includes these case abstractions and all of our findings to anybody who's interested in seeing the fuller results. But just to give a few examples to hopefully make this more illustrative, but for example, with our category of sustained and going strong, which was a category that we deemed to have high capacity for future sustainability, those were sites where the key informant indicated plans for the strategy to be sustained indefinitely, and where there was really no indication from our qualitative analysis process of the site lacking key components needed to keep it going long term. So for example, a case abstraction that we developed around one of the 17 sites within this category, we termed a team approach. That's the title we gave to the case abstraction. And so it was a church that had converted their existing pantry into a wellness and client choice pantry with the help of SNAP-Ed during the previous fiscal year. And in doing this, making these transitions, the site required significant promotional, logistical, and financial changes to the pantry. But the key informant and the rest of the pantry's leadership team was quick to implement the new strategies to address these challenges. And one of the things that they did to address the cost of increased quantity and quality of pantry items needed to be a wellness and client choice pantry, the pantry's leadership team had recruited 2 new members in order to specifically just be in charge of food drives, where the food drives were also asking donors to provide healthy foods. So they had a list really specifying of what foods are we looking for the pantry, and not just a free-for-all of accepting donations. And so another thing they talked about is that they were looking into strategies for diversifying their funding, and so they had really relied on just one major fundraiser every year, but knew that that wasn't going to be sustainable. So they were starting to implement strategies to do more fundraisers, to do grant writing. They had held a strategic planning retreat to brainstorm about short-term and long-term goals. So from a qualitative approach, we really found that they were thinking about and had started implementing strategies to then have high evidence of a lot of the sustainability domains that Nick reviewed. And so then another example of then the next category of sustained with site investment, but not stable. So these were strategies where there was a lot of interest among the sites in continuing the strategy indefinitely, but where the key informant that was interviewed articulated factors that would potentially cause a strategy to not be sustained long-term, such as not really knowing how to continue to have sustainable funding or staffing for a strategy. And so an example of this was a case abstraction that we titled Future Vision of Bigger and Better, which was a community center within a local parks and recreation system that had implemented an offsite garden with the support of SNAP-Ed. And the key informant was organizing programs and leading education classes dedicated to seniors. They were using food from the garden within some of those classes. They had partnered with a local food bank that had been a long-term partner of theirs, which was the site then of the garden. But what had happened over time was that a lot of the seniors were interested in the garden in the beginning, but then towards the middle of the growing season, interest had tapered off, and the key informant thought that part of that was because there were issues with the sprinkler system, And so people from the senior center were having to bring water to the garden themselves. But even having to do that, this key informant was still really committed to making sure the garden continued. And she started talking about the garden during all of the classes, like arthritis classes, for example, that she was teaching to recruit more participants to help with the garden. And so that did help get more of the seniors involved. And then her vision for the future, in order to try to help make it sustainable for longer term, was to move the garden to be on site with the senior center, so that it was more accessible and so that water was more readily available. And so just to give an example of then one of the categories of where we deemed it to be lacking, having low capacity for future sustainability. So for example, within our category kind of storyline that we deemed to be sustained with site planning to discontinue. So an example of that was a farmer who had started with the help of SNAP-Ed, started accepting SNAP in a state SNAP Healthy Incentive Program that we have here. It was a site that we deemed, the title we had was Try Again to No Avail. So it was a farmer who had started accepting these programs, thought it would be a great business investment because he was the only farmer in the county offering the program. He believed that people would be lined up down his driveway trying to buy stuff, but that the community interest never materialized. And he tried different strategies of going to different locations like subsidized housing complex, but still really wasn't getting the business that he had been hoping for. And so, being discouraged by the program, he articulated that he would not accept SNAP or the SNAP Healthy Incentive Program, of course, then as well, any longer after a 3-year grant cycle was up, that he had gotten a grant for the EBT card to be able to swipe the SNAP EBT cards. Once there was not funding for that machine, then he was not planning to invest funding on his own into the program any longer. So then thinking about, so that was one way that we looked at the results from more of a qualitative way. And then what we also did then was to look at, based on those two different categories of high versus low capacity for future sustainability, was there variance in the evidence based on domain? And so what we largely found from that then analyses was that we saw that sites that we deemed to have high capacity for future sustainability, that those sites had a lot more evidence of environmental support. So things like champions existing who strongly supported the program. And I do want to just articulate that this is champions, so not just one person who is really committed to the program, but really having buy-in from more than one person really seemed to lend itself to capacity for future sustainability. Another key difference between high versus low capacity for future sustainability sites was organizational capacity. So for example, having strategies that were well integrated into the operations of the organization and not just kind of a standalone strategy. And then also the other one was partnerships. So partnerships, so strategies that had investment where it wasn't just the site themselves who were really committed and making the strategy work, but having diverse community organizations invested in the success of the strategy. And then you'll see as well that the other two quote unquote domains that Nick talked about us on our own, then adding into this validated sustainability tool was around that people, SNAP-Ed participants being interested and involved in the implementation and sustainability of the strategy, as well as SNAP-Ed continuing to be involved with the site. We also saw a good bit of difference where sites with high capacity for future sustainability, there was much more evidence that these two things were in effect at the time of the interview. And so then some of our takeaways from this were then, really trying to, of course, encourage our SNAP-Ed implementers to, number one, just even have conversations around sustainability with sites, especially using this tool, which the tool that we used, we found is a tool that's recommended in the SNAP-Ed Evaluation Interpretive Guide. And sustaintool.org has a lot of very user-friendly templates to use for sustainability planning. So that being one thing. But then it seems from our results, which I certainly recognize is just, a sample from one state and just a little over 30 sites, but at least from our results, it really showed that kind of the most salient domains then that we think implementers should really focus on helping sites make sure they have high capacity around are the environmental support, organizational capacity, and partnerships, as well as really making sure that low-income people who are the ones that sites are creating these strategies, hoping that they will participate in, that instead of just hoping that they'll be interested or participating, really making sure that SNAP-Ed eligible people are the ones driving and really involved in, from the very beginning, the planning stages of and selection of PSE strategies, as well as really trying to make sure that SNAP-Ed implementers are able to stay in touch with sites over the long term. So for at UofSC, our implementation project, for example, with health clinics is that our health clinic program coordinator worked with 11 health clinics last fiscal year, where all of them adopted PSE strategies like setting up the clinic to screen patients for food insecurity and make referrals to offsite or onsite resources for nutrition. So even though the adoption happened last fiscal year, we wrote into our plan for this fiscal year and are working with them still, not as often, but still keeping in touch with them and working with them on sustainability planning and checking in with them periodically to make sure that things are still going smoothly, and if not, then helping with course correction or, identifying still needs to help build capacity around to make sure that the strategies are sustained for the long term. So that wraps up our presentation. But again, we're more than happy if people are interested in further conversation around this. We would love to have that, as well as to share our evaluation report info with you all.
Great. Thank you so much, Carrie and Nick. I do want to address one question that always comes up and did come up today, and then we'll have a few minutes for questions. Yes, the PowerPoint and the recording will be available to you all within the coming week, so you can share that with your colleagues or review it. And all of the speakers' contact information will be in that PowerPoint, so we do encourage you to reach out to them directly if needed, since I know we only have about 5 minutes for questions. We did get some going while the presentation was happening, so we will start with those. And one of them came in from Michigan, so we will read that and turn it over to them to respond. So the question was, did you find that the SNAP-Ed partners started this work with various levels of knowledge about PSEs? And if so, how did you address the training challenge when not all of the partners started with the same level of knowledge about PSEs? So Carrie, we'll go ahead and turn it over to you. Carrie Vassold from MFS, we'll go ahead and turn that over to you because that came during your presentation.
So this is Ann Lee, and I can take a stab at answering this question, and if Jason or Carrie have anything to add, please do so. But I would say yes, definitely. To give you an idea of who our partners are, they include school districts, health departments, universities, all the way to small grassroots nonprofits. And I would say that their knowledge of PSE change falls on a spectrum. and some are very familiar with this type of community work, and they've been doing it for years. While we also have other organizations where PSE change is really new, kind of uncomfortable. And one way that we have addressed this is through peer learning. For example, in the PSE exploration project, we held bi-monthly or monthly peer learning calls so that those with more experience in PSE could share promising practices or lessons learned with their peers who may be newer to this type of work. And then on a day-to-day support level, each partner is assigned a project manager and an evaluator at MFF. And we really just try to meet our partners where they're at. Just like our approach of working with locally relevant programming, we try to tailor our support that is relevant to the level that the partner is coming in with regarding PSE change. So, for example, those that are more experienced in PSE change, maybe we might encourage them to do, maybe we might encourage them to take their PSE change work to the next level, maybe incorporating more programming that would take them to measure long-term outcome indicators. And then those who are newer, maybe focus on building their capacity, doing more bite-sized PSE change. For example, if there's a school district and they're new to PSE, but they're really comfortable in the school environment, instead of expecting them to work on, a policy change in, the city's master plan, we might guide them to look more at what PSE changes that could be made in school environment.
Great, thank you for responding to that question. We had another question that came in that I think, Gil, you may be able to answer. Someone wanted to know what type of feedback have you received from agencies about administering the Slack tools you spoke about?
Yes, so we did just finish our validity testing. So we are testing validity, reliability, and feasibility, and we'll be modifying the Slacks based on that feedback. And I think one of the main feedback we got was that it was useful for identifying areas they could work in because they're comprehensive. It actually is kind of a list or a range of almost anything you could do. So it actually is a good planning tool. But people were concerned about how long it was and how much time it took to fill out. So we're going to look at trying to shorten it. That's always a challenge.
Great, thank you, Gail. And we have one final question that is relevant to Carrie and Nick's presentation that wanted to know what happens if when SNAP-Ed dollars go away from these programs? Is SNAP-Ed in discussions with these projects as part of a sustainability plan? I don't know if you have a response for that one.
Can you repeat the question? I'm just trying to make sure I'm understanding it correctly.
Yeah. So I think the question is related to sustainability. So what happens if when SNAP-Ed dollars go away from these programs? Does SNAP-Ed partners provide TA around a sustainability plan with the partners? Is that happening at all?
Yeah, so it's happening. Like, that's one of the things that we're really encouraging, and we've done some training around, is the sustainability planning piece. But of course, like, just because there's a written plan doesn't necessarily mean much. So that's why, speaking for our own implementing agency and the PSE projects we do with health clinics, libraries, a produce box model, and food policy councils, is, working with sites and partners on the written sustainability plan based on the templates provided on the sustaintool.org website. But then also not just walking away from the site once the plan's in place, but then cutting down on how often. So instead of, for example, checking in with the site and having a TA technical assistance call or visit every month, say, then it would be every quarter for a while. So just slowly, methodologically kind of taking a step back, while also not just, again, leaving immediately after a sustainability plan is in place, but making sure that that plan is actually being used and it's an effective plan before moving away from that site. If that answers the question.
Yeah, I think that's a great response, Carrie. So in interest of time, we're not going to have Brittany speak. She did want to send a few comments to you that I'll relay, that she wants to thank all of the speakers and share that you can find more information about PSE interventions and allowable costs on the SNAP-Ed Connection website and in the SNAP-Ed guidance and framework, which you all are familiar with. Thank you, speakers, for such an engaging and exciting webinar today about evaluation of PSEs. I hope this was helpful to the audience. As noted, we couldn't get to every question that was asked today, but we will encourage you to reach out directly to the speakers for follow-up, and you will receive a copy of the PowerPoint and the recording in the upcoming days. Thank you so much for joining us today, and we look forward to connecting with you all in the future. Bye.